Competitive landscape, global response to the lab leak theory and biodefense strategies. Overview. The COVID-19 pandemic has profoundly impacted global health policies, economies, and international relations, sparking debates about its origins. Among the hypotheses, the lab leak theory has gained traction, particularly following recent assessments by intelligence agencies including the CIA and FBI, which suggest a laboratory origin may be more likely than a natural spillover. This report examines how 10 countries are adjusting their biodefense strategies in response to these developments by 2024 and explores expert predictions on shifts in biotech investments by 2026. Key events timeline. 1. Early 2020, speculation begins regarding the origins of COVID-19, focusing on both zoonotic transfer and laboratory accidents. 2. 2021, the Biden administration orders a comprehensive review of the pandemic's origins, with initial findings yielding mixed conclusions. 3. 2023, FBI Director Christopher Wray publicly states the belief that a lab incident is the most probable origin, marking a significant shift in the intelligence community's stance. For January 2025, the CIA releases a new assessment under Director John Ratcliffe indicating a favoring of the lab leak theory despite low confidence in the evidence. Global reactions and adjustments in biodefense strategies. As the lab leak theory gains credibility, countries are recalibrating their biodefense strategies. Here's how 10 nations are responding. 1. United States. The U.S. is prioritizing investments in biosecurity research, enhancing laboratory safety protocols, and fostering public-private partnerships in biotechnology. The focus will be on developing vaccines and therapeutics rapidly in response to potential future pandemics. 2. China. Following heightened scrutiny, China is increasing transparency in its virology research and improving biosafety regulations for laboratories. The Chinese government is also investing in international collaborations to mitigate accusations and improve its global health image. 3. Germany. Germany is enhancing its biodefense framework by allocating more funding to biotechnology research and development. The country aims to lead in vaccine production and is working on establishing a European-wide biodefense mechanism. 4. United Kingdom. The UK is focusing on strengthening its pandemic preparedness through the establishment of a new agency dedicated to global health security. This agency will oversee research into zoonotic diseases and potential biohazards. 5. Australia. Australia is pursuing a more aggressive stance on biosecurity, with plans to increase funding for research on emerging pathogens and improve its capacity for rapid response to outbreaks. 6. India. India is ramping up investments in biotechnology and vaccine development, aiming to position itself as a global hub for vaccine manufacturing and distribution, especially for low and middle-income countries. 7. Canada. Canada is revising its biodefense strategies to enhance collaboration with international partners, focusing on data sharing and joint research initiatives to better understand viral origins and improve response strategies. 8. France. France is emphasizing the importance of integrating biotechnology into its national security strategy, advocating for a European framework that addresses both health security and technological sovereignty. 9. Japan. Japan is investing in advanced biotechnology, particularly in vaccine research and development, to ensure self-reliance in pandemic preparedness and response. 10. Brazil. Brazil is working on strengthening its public health infrastructure and investing in research that focuses on local zoonotic diseases to prevent future outbreaks. Biotech investment trends, expert predictions for 2026. Experts predict a significant shift in biotech investments as countries enhance their national security and health resilience. Key trends include increased funding. Governments are expected to allocate more funds to biotech research, particularly in vaccine development and bioinformatics. This shift will likely see a rise in public-private partnerships aimed at accelerating innovation. Focus on patents and intellectual property. As competition intensifies, countries will prioritize securing patents in biotechnology, particularly in areas such as genetic engineering, diagnostics, and therapeutics. Emergence of new players. Countries that have historically lagged in biotech, such as India and Brazil, are poised to emerge as key players. Driven by their large populations and growing investment in health infrastructure. Collaborative research initiatives. There will be a trend towards international collaborations, with countries pooling resources and expertise to tackle global health challenges collectively. Shift in market dynamics. Investors are likely to favor biotech firms that demonstrate agility in responding to emerging health threats, leading to a market shift where firms with robust biodefense capabilities attract more capital. Conclusion. The global discourse surrounding the origins of COVID-19 has catalyzed a reevaluation of biodefense strategies across the world. The lab leak theory's growing acceptance among intelligence agencies has prompted countries to invest more heavily in biotechnology, emphasizing the need for preparedness against future pandemics. As nations adjust their strategies, the biotechnology landscape is set for significant transformation by 2026, with increased collaboration, funding, and innovation at its core. This pivotal moment in global health policy highlights the interplay between scientific inquiry, national security, and international relations, underscoring the urgent need for comprehensive and coordinated efforts in public health and biodefense. Counterintuitive insights from the examination of the global response to the lab leak theory. 1. Intelligence agencies shifting consensus. One of the most counterintuitive aspects of the evolving narrative surrounding the lab leak theory is the apparent lack of new evidence, prompting a significant shift in intelligence agency consensus. Despite the CIA's recent assertion that a lab leak is more likely as the origin of COVID-19, this determination is based not on new findings but on a re-evaluation of existing intelligence that has been available for months or even years. This raises questions about the dynamics of intelligence assessments, suggesting that factors beyond empirical evidence, such as political pressures or leadership directives, may significantly influence the positions taken by these agencies. 2. Political implications of scientific debates. The debate over the origins of COVID-19 is not just a scientific inquiry but also a politically charged issue, particularly in US-China relations. While one might expect that scientific understanding would take precedence in discussions about pandemic origins, the reality is that political implications heavily skew the analysis. For example, John Ratcliffe's push for the CIA to take a definitive stance reflects an intersection of intelligence science and politics, where the implications of a lab leak necessitate a more confrontational approach to China. This politicization may lead to a situation where intelligence assessments are crafted with an eye toward geopolitical ramifications rather than pure scientific inquiry. 3. The role of patents in biotech strategy. The analysis of biotechnology patents reveals a counterintuitive landscape where the US leads in patent filings, followed by the EU and China. While one might assume that this patent lead translates directly into biotech dominance on the global stage, the reality is more nuanced. The focus on medical and industrial biotechnologies indicates a strategic prioritization that may not align with immediate public health needs or responses to emerging threats. For instance, the significant percentage of patents in specific biotech categories suggests that while innovation is robust, it may not necessarily equate to readiness for future pandemics or biodefense, highlighting a potential misalignment between patent activity and practical application. 4. The complexity of biodefense strategies. The response to the lab leak theory has led to a reassessment of biodefense strategies globally, yet the adjustments being made by different countries reveal unexpected complexities. For example, while countries increase investments in biotechnology innovation as a direct response to the COVID-19 pandemic, the specific areas of focus vary widely. The emphasis on certain biotechnologies such as white and red biotech highlights a competitive landscape that may not address the multifaceted nature of biological threats. This suggests that while nations are reacting to perceived threats, they may not be fully considering all dimensions of biodefense, potentially leaving gaps in their preparedness. 5. The misconception of technological specialization. Interestingly, the specialization patterns among different countries in biotechnology reveal a counterintuitive truth. While nations like Japan and China may excel in certain areas of white biotech, the US and UK focus more on medical applications. This could lead to the assumption that countries are uniquely positioned to address specific challenges. However, the reality is that the leading biotechnologies are similar across these nations. This shared focus indicates a potential redundancy in innovation efforts, suggesting that nations may not be leveraging their unique strengths effectively in the global biotech landscape. 6. Low confidence yet high stakes. The intelligence community's use of low-confidence assessments regarding the origins of COVID-19 is a particularly striking counterintuitive element. Despite acknowledging that the evidence is not conclusive, the agencies continue to pivot toward the lab leak hypothesis. This contradiction raises ethical and methodological concerns about how intelligence is interpreted and communicated to the public. The stakes of these assessments are incredibly high, influencing national security, public health policy, and international relations. Yet the foundation for these conclusions is characterized by uncertainty. 7. Potential for scientific breakthroughs over intelligence revelations. There is an inherent irony in the belief that answers to the origins of COVID-19 may lie more in scientific breakthroughs than in intelligence revelations. While intelligence agencies are traditionally viewed as the gatekeepers of information regarding national security threats, the reality is that the complexities of biological research and epidemiology may yield more definitive answers than clandestine intelligence operations. This suggests a potential paradigm shift in how we approach understanding pandemics, where scientific inquiry takes precedence over intelligence assessments in addressing biological threats. 8. The global biotech investment landscape. As nations increase investments in biotechnology in response to the lab leak theory and the COVID-19 pandemic, one might expect a straightforward correlation between threat perception and investment. However, the competitive landscape indicates that while investments are rising, they are not uniformly directed toward areas that would most effectively bolster health security. The disparity between patent filings and actual public health outcomes suggests that investments may be influenced more by national prestige or economic strategy than by a direct response to imminent health threats. Conclusion. The examination of the global response to the lab leak theory and its implications for biodefense strategies reveals a series of counterintuitive insights that challenge conventional wisdom. The interplay between intelligence assessments, political considerations, and biotechnology investments illustrates a complex landscape where empirical evidence does not always drive policy or strategy. As nations navigate these challenges, it is crucial to recognize these complexities to shape more effective responses to future biological threats. The report on the global response to the lab leak theory and its implications for biodefense strategies is rich with important details that many might overlook. Here are some critical elements and their significance. 1. Shift in intelligence community consensus. The report details a notable shift in the consensus among U.S. intelligence agencies regarding the origins of COVID-19. The CIA's recent assessment, which leans toward the lab leak theory, represents a significant change from earlier positions that favored the natural origins theory. The low-confidence nature of this assessment underscores the persistent uncertainties and limitations in available evidence. Yet it is important because it reflects an evolving narrative that could influence both domestic and international policy. Significance. This shift is significant as it could lead to heightened tensions between the U.S. and China, impacting diplomatic relations and potentially resulting in increased scrutiny of China's biotech practices. It may also affect public trust in government assessments and scientific discourse, amplifying political polarization regarding the pandemic's origins. 2. Biodefense strategy adjustments. The report highlights that various countries are reassessing their biodefense strategies in light of the lab leak theory gaining traction. The emphasis on biotechnology innovation suggests that nations are prioritizing advancements in this field as a means of enhancing health security. Significance. The adjustments in biodefense strategies could lead to a competitive race in biotech advancements, influencing market dynamics and investment trends. Countries may prioritize biotech research and development, leading to innovations that could improve responses to future pandemics, thus reshaping the global health landscape. 3. Intelligence versus scientific inquiry. There is an ongoing tension between intelligence assessments and scientific inquiry regarding the origins of COVID-19. The report notes that intelligence agencies are grappling with the implications of their findings while acknowledging the lack of definitive evidence supporting either the lab leak or natural origins theory. Significance. This tension raises critical questions about how scientific and intelligence communities communicate and collaborate. The implications for future pandemic preparedness and response strategies could be profound, as a misalignment between scientific understanding and intelligence assessments may hinder effective policymaking and public health initiatives. For patent trends in biotechnology, the Joint Research Center report highlights trends in biotech patents, with the U.S. leading in patent filings. It notes that a significant proportion of these patents pertain to medical and industrial applications, revealing the competitive landscape in biotechnology. Significance. The focus on patent trends is essential as it indicates which countries are investing heavily in biotechnology and where innovations are likely to emerge. This information could inform investors, policymakers, and researchers about potential future leaders in biotechnology, shaping global investment strategies and international collaborations. 5. Geopolitical implications. The report indicates that the lab leak theory's acceptance could have substantial geopolitical ramifications, particularly concerning U.S.-China relations. The narrative surrounding the origins of COVID-19 is not merely a scientific question but one intertwined with national security and global power dynamics. Significance. The geopolitical implications of the lab leak theory may lead to increased scrutiny of China's scientific practices and regulations. As nations reassess their biotechnological capabilities, this could foster competition that extends beyond health security into broader technological and economic arenas, potentially influencing global trade and diplomacy. 6. Diverse biotechnological specializations. The report indicates varying patterns of specialization in biotechnology across nations, with different countries focusing on different sectors such as healthcare, agriculture, and industrial applications. Significance. Understanding these specialization patterns is crucial for forecasting which countries may emerge as leaders in specific areas of biotechnology. This knowledge can guide international collaborations and investments, helping nations to strategically align with partners that complement their strengths and address their weaknesses. 7. Public perception and policy. The evolving discussion around the origins of COVID-19 is likely to influence public perception and government policy relating to biotechnology and health security. Significance. Public trust in health authorities may wane if there is a perception of inconsistency or politicization in the scientific narrative surrounding COVID-19. This can lead to challenges in implementing health policies, particularly in areas such as vaccination campaigns or biosafety regulations, which rely heavily on public compliance and trust. In conclusion, while the report covers various aspects of the lab leak theory and its ramifications on biodefense strategies and biotechnology investments, the nuances and implications of these developments are crucial for understanding their broader impact. The interplay between intelligence assessments, scientific inquiry, and geopolitical dynamics is multifaceted and will continue to shape global health policies and international relations in the coming years. 1. Shift in intelligence assessments on COVID-19 origins. The most valuable point is the evolving stance of U.S. intelligence agencies regarding the origins of the COVID-19 pandemic, particularly the CIA and FBI's increasing alignment on the lab leak hypothesis. This shift reflects a significant change in the narrative surrounding the pandemic's origins, moving away from the natural transmission theory. The implications of this shift are profound, potentially affecting US-China relations, public trust in scientific discourse, and the political landscape surrounding pandemic preparedness and response. 2. Implications for biodefense strategies. Countries are reassessing their biodefense strategies in the wake of the lab leak theory gaining traction. This has led to increased investments in biotechnology, particularly in medical and industrial applications. Understanding how different nations are adjusting their biodefense strategies in response to perceived threats from biotechnological advancements and potential future pandemics is crucial. The focus on enhancing capabilities reflects a proactive approach to health security, influencing national policies and international cooperation in biotech innovation. 3. Market shifts in biotech investments. The anticipated market shift in biotech investments by 2026 is another critical point for analysis. As countries ramp up their efforts in biotechnology research and development, the competitive landscape is expected to change, with the US currently leading in biotech patents. Analyzing the trends in biotech investments, the types of technologies being prioritized, and the potential economic impacts on global markets provides insight into how nations are positioning themselves for future health crises. For international competition in biotech innovation, the competitive landscape of biotechnology innovation highlighted by the Joint Research Center's report underscores the differing specializations among countries. The US, EU, and China are all focusing on various aspects of biotech, yet there is a clear trend toward collaboration and competition in key technological domains. Analyzing how these specializations affect global biotech markets, influence international relations, and shape the future of health security initiatives is essential for understanding the broader implications of the pandemic and the lab leak theory. 1. The Tuskegee Syphilis Study 1932–1972. This infamous biomedical research project conducted by the U.S. Public Health Service studied the natural progression of untreated syphilis in African American males. Participants were misled and not given adequate treatment for their syphilis, even after penicillin became a standard cure. The study raised significant ethical questions about informed consent, racial discrimination in medical research, and the responsibilities of government agencies. The Tuskegee study underscores the need for stringent ethical standards in biomedical research and has led to the establishment of regulations regarding human subjects in research. 2. The Anthony Fauci and HIV/AIDS research controversy 1980s to 1990s. Dr. Anthony Fauci, as the director of the National Institute of Allergy and Infectious Diseases, faced intense scrutiny and criticism during the early years of the HIV/AIDS crisis. Activists accused the government of negligence and slow response to the epidemic, particularly regarding drug approvals and research funding. The controversy led to significant changes in how the U.S. government addressed public health crises, emphasizing the need for rapid response, transparency, and community engagement in health policy. This scenario illustrates the critical intersection of public health politics and scientific inquiry. 3. The Chernobyl nuclear disaster 1986. The explosion at the Chernobyl nuclear power plant in Ukraine is one of the most catastrophic nuclear accidents in history. Following the incident, the Soviet government initially attempted to conceal the extent of the disaster and its implications. The event significantly influenced global nuclear policy, leading to greater scrutiny of nuclear safety protocols, emergency response strategies, and international cooperation in disaster management. The disaster highlighted the importance of transparency, accountability, and the need for rigorous safety measures in high-risk industries, paralleling concerns about biosecurity and lab safety in the context of the lab leak theory. Future outlook: predictions for global biodefense strategies and biotech investments by 2026. As we move into 2025 and beyond, the global response to the lab leak theory has prompted significant shifts in biodefense strategies across multiple nations. Countries are increasingly re-evaluating their preparedness for pandemics and biosecurity threats. especially in light of emerging intelligence assessments that suggest a lab-related origin of COVID-19. This summary provides an analysis of the anticipated changes in biodefense strategies among 10 countries by 2024 and offers predictions regarding market shifts in biotech investments by 2026. 1. Enhanced biodefense strategies. Countries are expected to adopt more robust biodefense frameworks by 2024 characterized by investment in research and development. Governments are likely to increase funding for R&D in biotechnology and synthetic biology. This will involve both public and private sectors aiming to develop faster diagnostic tools, vaccines, and therapeutics in response to potential pandemics. International collaboration. Nations will prioritize international cooperation in biodefense, sharing data and resources to better monitor and respond to biological threats. Platforms for real-time information exchange will be established, fostering collaboration among intelligence agencies, health organizations, and biotech firms. Regulatory overhaul. There will be significant changes in regulatory frameworks governing laboratory safety and bioethics, particularly concerning high-security labs. Countries may implement stricter oversight of laboratory practices to mitigate risks associated with handling dangerous pathogens. Focus on dual-use research. An emphasis on dual-use research of concern DURC will emerge, where the potential for misuse of research findings will be scrutinized. This focus will influence grant funding and approval processes, ensuring that research is conducted responsibly. 2. Country-specific adjustments. Various countries will adapt their biodefense strategies uniquely. United States, expect a reinforced emphasis on domestic production of vaccines and therapeutics. The U.S. will likely enhance its stockpiling capabilities and establish rapid response frameworks for future outbreaks. China, in reaction to external scrutiny. China may adopt more transparent practices and collaborate internationally on health security initiatives while continuing to bolster its biotech sector. European Union. The EU will push for a unified approach to health security, potentially leading to the establishment of a European Health Agency. Investments in innovative biotech solutions for disease prevention and management will be prioritized. India, as a prominent player in vaccine manufacturing, India will likely expand its capabilities in biotech, focusing on both domestic needs and international supply chains. Australia and Canada, both countries will enhance their surveillance systems and invest in public health infrastructure to better prepare for future pandemics. 3. Predictions for biotech investments by 2026. The shifting landscape in biodefense strategies is set to have profound implications for the biotech investment market. Increased investment volume. Biotech investments are expected to rise significantly, with projections indicating a growth rate of over 15% annually through 2026. This surge will be driven by heightened demand for health security solutions and innovative biotech breakthroughs. Emergence of new startups. There will be a proliferation of biotech startups focusing on pandemic preparedness, particularly in areas like mRNA technology, CRISPR gene editing, and AI-driven drug discovery. These startups will attract venture capital and government funding due to their potential for rapid innovation. Public-private partnerships. Collaboration between government and private biotech firms will increase, leading to co-development of vaccines and therapeutics. This approach will be crucial for expediting research and ensuring timely responses to health crises. Geographic shifts in investment. While the US and EU will continue to lead in biotech investments, emerging markets like India and Brazil are predicted to see substantial growth. Investment in these regions will be encouraged by favorable policies and a focus on addressing local health challenges. Sustainability and ethical considerations. As the biotech sector evolves, there will be a growing emphasis on sustainable practices and ethical considerations in research. Investors are likely to favor companies that prioritize environmental, social, and governance (ESG) criteria. Conclusion. In summary, the global response to the lab leak theory is reshaping biodefense strategies and driving substantial changes in the biotech investment landscape. By 2024, countries will have adopted more rigorous frameworks to prepare for biological threats, while by 2026 the biotech sector is poised for significant growth influenced by increased investment and innovation. The interplay between national security considerations and health preparedness will define the future of biotechnology, fostering an environment ripe for advancements that can enhance global health security.